Let's talk about the diagnosis for obsessive compulsive disorder. This information comes from the DSM-5 and the mental disorder study guide. I made link in my bio for that. If you are experiencing these symptoms and they're causing a disturbance to your daily life, I encourage you to reach out and talk to a therapist or your doctor about how these symptoms are impacting you. I'm not making this to fearmonger or over pathologize. I just want to spell out exactly what the diagnostic criteria is for obsessive compulsive disorder so that you can empower yourself in your relationship with your medical team or your psychiatric team. Obsessive compulsive disorder involves a cognitive element involving thoughts and also a compulsive element involving behavior and urges. The person needs to be experiencing obsessions, compulsions, or both. Obsessions are defined as recurrent and persistent thoughts. Thoughts, urges, or images that are experienced at some time during the disturbance as intrusive, unwanted, and in many people cause anxiety and distress. The individual attempts to ignore or suppress these thoughts, urges, or images, or to neutralize them with some thought or action, for example, by performing a compulsion. Compulsions are defined through repetitive behaviors, such as hand washing, ordering, checking, or mental acts like praying, counting, or repeating words silently. The person feels driven to perform in response to an obsession or in according to rules that must be applied rigidly. In order to be diagnosed with obsessive compulsive disorder, the obsessions and the compulsions must be time-consuming. For example, take more than 1 hour per day, or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Obsessive compulsive disorder is in the disorder class of an anxiety disorder, but for someone to be diagnosed with obsessive compulsive disorder specifically, it needs to not be better explained by a different type of anxiety disorder. The disturbance is not better explained by the symptoms of another mental disorder. Excessive worries, as in generalized anxiety disorder, preoccupation with appearance, as in body dysmorphic disorder, hoarding disorder, hair pulling, ritualized eating behavior, preoccupation with substances or gambling, difficulty controlling your impulses, such as impulse control issues or conduct disorders, guilty ruminations, which may be more associative as in major depressive disorder, thought insertion or delusional preoccupations, as in the schizophrenia spectrum or other psychotic disorders, or repetitive patterns of behavior, as in autism. It's not social anxiety, it's not hoarding, it's not autism, it's not psychosis, it's not another form of anxiety. Obsessive compulsive disorder, marked by the presence of obsessive thoughts and compulsive behavior to try to soothe the thoughts, needs to be present in order for someone to specifically have the obsessive compulsive disorder diagnosis. The disturbance cannot be due to some psychological, physiological effect of a substance or medication or any other physical health condition. There is a specifier with obsessive compulsive disorder regarding insight. Specify if good or fair insight. The person recognizes that obsessive compulsive beliefs are definitely or probably not true and that they may or may not be true. With poor insight, the individual thinks that obsessive compulsive disorder beliefs are probably true. Or with absent insight / delusional beliefs, the person is completely convinced that the obsessive compulsive disorder beliefs are true. And the last specifier is tic related. The individual has a current or past history of a tic disorder. If you experience obsessive thoughts, compulsive behaviors that are impacting you in more than one area of your life in a severe way, I encourage you to reach out to your doctor or therapist to discuss your anxiety and how these behaviors and these thoughts are impacting your ability to care for yourself, achieve what you want, and have the relationships that you need in your life.